Hello everyone, my name is Emily Woodley and I am the Family Birthplace Manager at Jamestown Regional Medical Center. And my topic of discussion today is safe sleep. So safe sleep is so important for newborns from 0 to 1 years of age. And the reason why is to help decrease the risk of sudden unexpected death syndrome in newborns, and anything we can do to decrease the risk of death is so very important. So I will go over the key steps that the American Academy of Pediatrics, the CDC, Cribs for Kids, all of those organizations have come up with tactics that decrease the risk. So we're going to show you that and talk through that. So first of all, you always want to put baby on their back to sleep. So when you're going to place baby in their crib, you want them to be on their back. Here I have a room set up and you can see that baby is right next to mom's bed, and that is ideal. They recommend actually that baby stay in mom's room for the first 6 months of life, not in bed with the mom or dad, but in their own safe sleep space. So we have a crib here. There is nothing else in the crib, and that is because we don't want the infant to roll over on anything or suffocate in any way. So no pillows, no bumper pads, no stuffed animals. That is the best practice. And actually, when you're laying babies down, you should even take their hat off because they can overheat as well. Putting baby on their back again. This is baby in a safe sleep blanket. You can put baby down in their own sleeper or a sleep blanket, a swaddler, whatever you want for that, but not with fluffy blankets or loose blankets. So put baby right on their back. If they're needing a pacifier actually has shown to decrease the risk of SIDS. So you do not have to force it, but if they want a pacifier, it's okay to take that. And then if it falls out when they're sleeping, it's okay to leave that in the crib. All right. The other things that decrease the risk of SIDS is breastfeeding. Breast is best for baby, and so that can decrease your risk of SIDS. Also, going to regular medical appointments, making sure baby is up to date on their heart and lung assessments and in good health. Research has actually also shown that not smoking around baby or not drinking alcohol and those things. The reason why is smoke is bad for secondhand smoke exposure, and that can just cause lung trouble in newborns. And also for the alcohol and drug related issues and concerns with that is people make poor decisions when they are using those items, and so it's recommended that you don't use those items when you are caring for a child. So I want to warn you to not use heart monitors or systems that monitor your baby at night to make sure that they're breathing. Those actually give parents a false sense of security and have not shown to decrease the risk of SIDS. So the American Academy of Pediatrics does not recommend the use of those. Also, making sure again that your baby is in a safe sleep space means not in the swing, not in the car seat, not in any of those things. Babies can cut off their air supply if their neck is not strong enough to keep that up, and they can stop breathing for that reason. Also, I want to recommend not using any wedges or positioners, rolled up blankets. I know a lot of parents worry about their babies having flat heads. However, simply giving baby tummy time during the day when they're awake will take care of that. So we recommend about 5 minutes of tummy time for a total of 20 minutes a day, but 5-minute increments here and there, and that will be good. It also helps with their strength and holding their head up and their neck muscles. Also, having a fan in the room blowing the air around and circulating. You don't want the fan directly on the baby, but in the room moving the air is a good thing to do. Going back to the sleeper and the swaddle blanket, some parents worry that their baby's going to be too cold. But actually overheating your baby, like I talked about with the hat, is a bigger risk of SIDS. So babies are comfortable in a sleeper and a swaddle blanket, and that will suffice for that. Also, one of the trickiest parts about safe sleep is educating grandparents or older generations. They raise their kids on their tummies, and they often will not be very supportive of the changes in this practice. So I encourage you to teach those that don't know that we have done all this research. It has decreased the risk of SIDS tremendously by having babies on their back to sleep. And so just being supportive in that way really is helpful. So by following these tactics that I have gone over, you can decrease the risk of sudden infant death syndrome, which I encourage any parent to do. Thank you.